everybody. I'm glad to have you all here today. My name is Cherish Hart, and I'm a Vice President of Community Impact with the American Heart Association, based here in the Seattle, Washington area. Today, we're really excited to have you all join us. It is Heart Month, February. Every February is American Heart Month, and it's a great time to be able to think about your heart health. Although we, of course, encourage you to think about heart health year-round, it's an opportunity to dive in and learn a little bit more about how we can have a healthy heart. So today, we are glad to be here. This event is sponsored by Cambia Health Foundation, which is the corporation that's funded in part by Regions Health Plans, which they serve members throughout, our area in the Northwest, Utah, and Idaho. And we've joined forces with them to improve overall heart and physical health for women and their families in our communities. So a couple of housekeeping items before we get started is this is a webinar discussion, and we're happy to have it be interactive. So if you have questions that you want to submit, you can submit those in the Q&A, or you can add them into the chat feature. I think many of us have been on Zoom meetings before now that we've lived in this hybrid and virtual. Is usually you can find that on your Zoom feature, usually on the bottom of the screen. And you can click on that and be able to add in the chat. Couple of things, if you want to make sure that your message goes to everyone, you'll want to choose the option for all panelists and attendees and change that function there. You also can control kind of how your Zoom screen looks if you want to have a closer view on the slides when we have slides, or on the people on the screen, using some of the controls here as well. But you don't have to worry too much about that. You can just sit back and relax and enjoy the presentation today. We've got some great friends of the Heart Association who will be joining us today. First of which is Claire Verity, who is going to be your moderator today. And Claire has actually been a volunteer and advocate with the Heart Association since she was a teenager. And she's currently the market president for Regions Blue Shield here in the Pacific Northwest. And she has a ton of responsibilities in that statewide operations, sales, contracting, government affairs, community relations, a little bit of everything. But she's not only been involved with the Heart Association for years, she's also really has a long history of board service on other Northwest nonprofits as well. And here has really been involved with our Go Red for Women campaign and leading that campaign the last few years, as well as our Women's Health Council. So you all are in good hands for this event today. And I'm going to turn it over to you, Claire, to introduce our other panelists and kick off the conversation.
Thank you, Cherish. I really appreciate that. And I'm happy to be here today, really to kind of bring forward an important subject, especially during our wonderful Heart Month, which I always enjoy. A couple of facts just to kind of get us started, and then I'll introduce our esteemed panelists, who I'm very excited to have here. But heart disease and stroke can have really serious consequences on our health. Heart disease continues to be the #1 cause of death in the United States. And a fact I actually did not know until recently was that stroke-related complications are the #1 cause of long-term disability. So a couple of things to keep in the back of your mind as you're thinking about why should I care and what action can I take. We'll cover a few of those topics today, but I really want to send a sincere appreciation for you attending today and taking the time to really prioritize your health. We don't do that, I think, often enough. So again, achieving heart health it doesn't fit one size, right? We all approach this differently. But the Heart Association, and I'm wearing my little 8 key today to kind of remind myself, but the Heart Association has defined kind of key measures called Life's Essential 8. And those are to improve and maintain cardiovascular health. You can select or you can see, excuse me, those 8 on the slide that's being presented right now. And they cover the gamut from healthy weight to blood sugar to know your numbers. But you're going to hear some of the themes around these life essential 8s through the conversation today. So really think about those and think about how those appear in the conversation, but also how they might apply in your own life. So pretty excited about those life essential 8. We have a couple great, amazing Heart Association partners and volunteers with us today who will dive right into a conversation. This is not a presentation. You're not going to see a bunch of slides. It is truly a conversation that we hope that will spark some ideas on how to take care of your own heart health and those that you love. But we also want to remind you again to drop us any notes in the chat function. And you might even want to think about, again, that way to take action, even starting today, on how to improve your heart health. And I know our panelists will be giving you some really good tips and ways to be thinking about that. So again, feel free to submit any questions or comments you might have in the chat function. So let me introduce you to our panelists today. And I'm going to read a little bit of this because this is a lot of information, but really important information. So Dr. Heidari, who is joining us, he completed his echocardiography fellowship at Harvard University Medical School, Brigham and Women's Hospital, after he received his general cardiology training at the University of Southern California. After that, Dr. Heidari finished an advanced cardiac imaging fellowship in cardiac MRI at Stanford University. You could tell he was a very busy student and fellow and ultimately doctor. He is now a clinical instructor at the University of Washington, Department of Family Medicine, as well as a director of specialty at CMAR Community Health Clinics in Seattle. He is currently the president of the American Heart Association board for the Puget Sound, where we serve together. And his goal is to help every patient as much as possible every time. He is committed to achieve the best well-being and health for his patients. Dr. Bowman is president of the Western States region of the American Heart Association. She has been an AHA volunteer for over 35 years and has served on national board as well as the many regional and national committees. Dr. Bowman, retired from her internal medicine practice in 2017 and currently resides in Seattle. Both are extremely passionate about this topic, and I just love the fact that we have this time together to have this conversation. So let's get started. So Dr. Heidari, I'm going to start with you first. When we think about heart health, what does it mean to be in good heart health?
Well, thank you very much for having me, Claire, and the American Heart Association, and thanks to Regents and all the sponsors and everyone who is here, and Dr. Bowman. It's really an honor to be here, and really this is something that is really important for everyone, I think, heart health. I was thinking of that question. So I mean, I think it's what we already know. It's what your grandma taught us and teaches us, that, you know, do what you said in those life's essential 8. You know, if you have a healthy heart, I think you're physically active, you're trying to watch what you eat, you check your blood pressure, you see your doctor yearly, try not to smoke, and, you know, try to kind of help your heart beat all those beats that we need to do. So I think it's multiple things, as you said. Try to do as many as you can, and hopefully we can, you know, see if there's any specifics during the conversation.
Dr. Bowman, would you like to add some comments on what it means to be in good heart health?
Yeah, I think I agree with everything that Dr. Heidari said, and I would add that the real goal is to live well until you die. I mean, we're all going to die, right? But the goal is to live well. And I have a patient who, in the next couple of months, is celebrating her 100th anniversary. This was when I was in Oklahoma City, and she's invited me to her 100th birthday party. And here's a person who is still walking a mile or two every day. That having that ability to live, and she's dancing, having that ability to live a happy life free from lots of limitations, limitations of stroke, congestive heart failure, all of those things that happen. That's really my understanding of being heart healthy.
That's wonderful. I hope, I hope to be doing that at that age. It just takes a little bit of gumption and motivation to do that. But if we can get out even for a small walk every day, just some level of activity or something else that you can do if walking isn't your thing. So thank you for sharing those insights.
Yeah, I told her I wanted to be her when I grow up.
That's awesome. So again, thank you. So when we think about starting our conversation to get today and the goals that we might have in mind, let's dig into what we should do to achieve those things. Sometimes it's really easy to talk about them, but how do you start to achieve those goals? So Dr. Heidari, one of the things you called out in your definition, as we were kind of talking about a little bit, as we think about knowing numbers and kind of knowing your health, what about blood pressure? What do our listeners need to know about blood pressure? What should they be doing? And maybe a first step for them if they haven't thought about their blood pressure.
Yes, that's a great question because I'm pretty passionate about blood pressure. Just wanted to say about half the people in the United States have high blood pressure. So half the people on this call have high blood pressure. So it's so prevalent. It's extremely easy to diagnose. So just go to the pharmacy, go to the fire department. You can even check them out at your library, a blood pressure cuff. You can buy one or go see your doctor on a yearly visit to check your blood pressure. It's very easy to do, and it's actually quite easy to treat. So it's nothing to be worried about. You know, we have good medications and good lifestyle changes to treat high blood pressure. And it's so important. I teach here and I teach all the students that it might be the single most important risk factor for all heart problems and stroke and kidney problems. So it's really, really important. Just check. I would just say, don't be afraid. You know, just go make an appointment for your doctor or go to one of the local places and just check your blood pressure. And, you know, we can follow up on it.
And I would agree. And I would also add that if you do have high blood pressure, take your medications. And if those medications are not comfortable for you, you have side effects. We have so many, as Dr. Heidari said, so many good medications. We have inexpensive medications. You can find a regimen that works for you. Sometimes it may take a little trial and error, but I agree with him. This is the most important thing that you can do. I heard Dr. Lloyd Jones, who's done all the metrics for our Life's Essential 8, say that if we could get everybody's blood pressure under control in this country, we would make the goal to improve everybody's cardiovascular health in this country by 20%. That's how important this is.
That's amazing.
Yeah.
Wow. Let that sink in for a little bit. So when we think about the numbers, there's a systolic and diastolic if you're in the industry. When you're taking your blood pressure, one of the things though, there are certain things that can put us at risk. And I think you kind of mentioned a few of those earlier on. But I think for folks, blood pressure is a really interesting one because sometimes the warning signs aren't as obvious as other things. So I'm wondering if either of you, maybe can start with Dr. Heidari, what are those warning signs that people should be looking for when they think about, blood pressure issues?
Yes, so I'm glad you mentioned that. These are great questions. So unfortunately, blood pressure is the silent killer, remember? So we don't get the warning signs until something is happening, which we're going to talk about, I think, later in terms of warning signs for heart attack and stroke. But I think as Dr. Bowman said very well, I mean, going to your doctor and checking and getting it treated. But if you happen to have signs of a heart attack or a stroke or kidney problems, that's just even more important that you really should get it checked. I do want to say that, a lot of the things are related to our lifestyle. So, sometimes you don't really have to just dive into taking medications. A lot of those things that were on the Life's Essential 8, just getting physically active, watching your diet, watching your salt intake, maybe less processed foods, watching the alcohol, those things can be related to high blood pressure.
Absolutely. And I've had patients tell me, well, I can tell when my blood pressure is high. And the thing I always say is, well, you may be able to tell when your blood pressure is 200 over 120 because you're going to have headaches and you've got to get to the hospital. But you will not feel if your blood pressure is 140 over 90. And we know that increases your risk of heart attack and stroke. And it's like your tires in your car. If you run them too high for too long at too high a pressure, one of two things is going to happen. Either they're going to blow, or you're going to shorten the life of the tire. And that's the same thing with high blood pressure.
Sorry about that. Just a quick call out on blood pressure, because I'll take it to a kind of a personal reference. I was in my seeing my dentist a few years back, and I happened to be under a little bit of stress during that time, and they routinely take my blood pressure when I go in to see for my cleanings or other kinds of activities. So it was really good. Well, it was good, but so they took my blood pressure and it was high, like to the point where they said, you probably need to go to the hospital. And so I would never in a million years had thought, boy, I probably should have that looked at. You're stressed or you're putting something off. So I can't emphasize enough. Find the places, Dr. Haidari mentioned it, Dr. Bowman's mentioned it. Find those places that you can go just to get it checked, just to check it out to make sure. It's simple. It takes a minute or two to get it done, and at least you know what your blood pressure looks like at that juncture.
And I had a story too. I mean,
Yeah,
I
yeah.
would say in my experience here working in a community clinic, I see all the complications of high blood pressure in younger patients earlier than should be the case, and it's worse than it should be the case. So as long as you can go to check it or go to your yearly visits, even if you just go to once a year wellness check with your primary doctor and your internist, we'll catch it. I know you can prevent those events.
Yeah, I think I once read that it takes about 11 to 15 years if you have high blood pressure to start to see the end organ damage, which means damage to your kidneys, your heart, your brain, et cetera. And so if people are starting younger ages, then they're not going to be very old when they are at risk of complications.
That is a really good point. And I will just add on, because I think we tend to think of heart disease, high blood pressure, other things as kind of an older person. It kind of comes on over time, and yes, it does come on over time, but it really the almost a crisis in the younger population now. That the amount of individuals with heart disease at earlier ages is exponential at this point. I don't have the stat, but maybe somebody from the AHA can put that on. I want to say like 20%, but I could be wrong on that. Okay. So Dr. Bowman, you got me thinking a little bit about healthy habits. Sometimes those are hard to get into, but you got to take one step at a time. So a lot of us try new ones. January 1, maybe it's a dry January, or I'm going to start exercising or eating, healthy. But you tend to kind of lose a little steam over time. And, but I do think it's important to talk about healthy eating. And I'm wondering if you can share with us a little bit more about kind of conflicting information out there around healthy eating. So what takeaways or advice do you have for us today on that?
I try to make it kind of simple, because these can be really complex if you're really trying to follow everything. But, more fruits and vegetables, nuts and beans, less red meat. Notice I didn't say never red meat, less red meat, fish a couple times a week. I mean, lots of opportunities there. And you can also sum it up in eat out less, right? Because when you eat out, you're eating high fat, high sugar, high salt foods. And then you take them home in a doggy bag and you eat them the next day also, right? So eat out less. Eat unprocessed foods. I mean, we all know lunch meats are processed, but if you look at the labels of something, you'll be surprised. If you see a lot of ingredients that you really don't know what they are, that's likely an ultra-processed food. And we're getting more and more data about the risks of that as well.
Good good. Dr. Haydary, anything to add to that?
Yeah, that was well said. I mean, I think on the processed food and the sugars, a lot of people don't make the correlation that sugar will raise your cholesterol and sugar will, cause heart disease, and relate to diabetes, which is a high risk for heart disease, rather than just focusing on the fats. I think I would try to add that too. One tip would be, try not to eat dessert every day. Try not to buy desserts at some of these
It's
big
hard for
places.
some of us.
That's right, I know. And so, definitely on your birthday and your kid's birthday and your neighbor's birthday and all these other birthdays, but, you have to try to kind of work it in. I would suggest, in my humble opinion, that sometimes if you do a small thing, but you do it consistently,
Mm,
that gives you a little bit more positive reinforcement and you get more encouraged, and then you can build on that.
I
Really good.
love- Oh, go ahead. Sorry. I'm sorry. Go
I
ahead.
just agree. That's a very good way to approach.
I think the small step and the consistent one, you get to that habit forming piece of it, and pretty soon it just becomes, your normal course of daytime activity and actions. And
And
I'm
you can change your taste buds, if I can just add that. You can change your taste buds, right? Especially for salt. We
yeah,
Americans love our salt, right? We need 1,500 milligrams a day. Most of us eat well over 4,000 milligrams a day. But if you are consistent in decreasing your salty intake, you will find that after a few weeks, you go back to something that is that salty, and it will taste weird to you. It'll be burning your lips. So you can change your taste buds. It's as both of my colleagues here said, it's the consistency in doing it that makes the difference.
no, for sure. I like the notion when we go out and you get something that appears to be healthy. Let's say some salmon, right? On the surface, it sounds great, but there's probably a lot of butter, a lot of salt, a lot of other things that you have no idea, no control over what's on that. So we have to just be really diligent about that and think about ways in which when we do go out to choose a somewhat healthy option, that kind of where the ingredients are.
If I may, can I
oh,
comment
yeah.
on one other thing? I think the mental health component of
Mm.
eating and heart health is important, especially stress. And there's a lot of chronic stress, and a lot of people stress about weight and diet. And I just wanted to try to put a word out that if at all possible, try not to stress about it and use some of the techniques that were discussed here. Small things go a long way, because that stress response kind of negatively impacts the whole process.
That is a really brilliant connection point. I think when you think about those, everybody has little stressors, little or big stressors in their lives. And sometimes you tend to go toward things that aren't healthy. But just understanding those connection points is really, really important. I'm glad you brought that up. Dr. Haydary, what about blood sugar and cholesterol levels and the impact to heart health, and what should we know about it, and is that an issue? What should we be thinking about today on that?
Right. So diabetes, which is this condition where our blood sugar is high, is in many people's mind a correlate with heart disease, meaning that the risk of heart disease is high enough that it's almost assumed that many diabetics have heart disease. At least it doubles your risk. So, think about doubling your money, so that everyone that can understand that that's a lot of a risk.
Yeah.
And that's okay. And we talked about mostly it's related to physical activity and weight and food, but also getting checked. I mean, I have a lot of people that have never actually gotten blood tests or haven't gotten them in many, many years. And as you mentioned before, there's an epidemic of obesity in this country. Our youth, about 20%, are obese. Adults, about 40% are obese. And that's related to this concept of sugar, the sugar that's available, the processed food, like Dr. Bowman said. And then that causes high cholesterol as well. It contributes to heart disease. And so it's just a little bit of a cyclical argument.
Yeah, for sure. Are there when we talked about blood pressure, right, there is a target blood pressure people should be generally at. What, and I don't know if we actually mentioned that, but if, on the blood sugar and the cholesterol levels, what should people be aiming for and looking at when they do get their blood tests and they get their results? I mean, obviously hopefully their doctor is talking to them about them too, but you might want to give the folks on today maybe some things to be thinking about.
Yes, sure. I think it depends on who you are, your age, what your risk factors are. If you have high cholesterol plus diabetes plus you've had a heart attack before. So it kind of helps define what your targets are. And I think the American Heart Association, the American Diabetes Association have cutoffs for how you make a diagnosis of high sugar and high cholesterol. And then the targets are kind of based on your risk. That's how we approach it these days. What is your risk of having an event, having a stroke, having a heart attack, having peripheral arterial disease? And then you can talk with your doctor on treatment.
Great, good. Dr. Bowman, anything to add before I move on?
Well, with our Life's Essential 8, the target for your blood sugar is, we always used to be a fasting blood sugar under 100, but there is a measurement called hemoglobin A1C, which gives you an idea of what your blood sugar's been over 3 months. And we want it to be less than 5.7, according to the Life's Essential 8. I agree with Dr. Hodari that we're getting more and more specific for individuals, because that less than 5.7 might be fine for somebody who doesn't have any other risk factors, but maybe too high for somebody else who is at very high risk. And so it makes sense. And it's really helpful to start targeting what are the right ways. And for our cholesterol, I will say that the old Life Simple 7 instead of Essential 8, Life Simple 7 looked at total cholesterol, and now we're looking at the non-HDL. HDL is the high density, higher is better, that's the good. It's looking at the non-HDL, which are all categories of low density that causes the hardening of the arteries, the atherosclerosis. We're looking at that now for the levels, and it does vary depending on your age, et cetera, that you're going on.
Interesting. I just had my eldest son just had a routine his annual physical, and his cholesterol is too high. We have some family history and some other things, and I think he's very active, so it might be just more of a genetic type of situation versus lifestyle, but they are trying some different things. But again, a younger person, no symptoms, doesn't know, but at least he is getting in for that annual physical once a year to see how things are progressing. So we'll see what happens over the next few months. Dr. Bowman, we were referencing behavioral health and some of those interesting connection points on things that people might not think about as they think about heart health. But sleep is on that Essential 8 slide, so that we shared earlier. So I understand that newer additions to behavioral health, some of the things that we're seeing and we're talking about today. But why is sleep so important to health and to heart health?
I'm really glad this was added, because we were seeing more and more data about this. First of all, because so many people are not sleeping well for a whole variety of reasons. Often it's this thing. I guess I don't know if you could be that thing that is it, or some facsimile of it. But we see that it increases your risk of cardiovascular disease and stroke. And the reason is because we think of sleep as you're not doing anything but dreaming, but actually it's a very busy process. There's healing and repair of cells, of the blood vessels. You have a stronger immune system if you sleep well. So not only for heart disease and stroke, but also for cancer. If you get better sleep, you decrease your risk. You think better. You're better at decision making. You can focus your memory. We're all worried about our memories. Your memory is better. So what we've realized is that it's very, very important that you have less of a chance of one of these chronic diseases we're talking about. if you get the right amount of sleep, which is recommended to be 7 to 9 hours of sleep. And for adults, a lot of people live on a lot less than that. But that's what the data shows. AHA always goes with what the research shows. And that's what is for healthy for adults, and 10 to 12 hours for kids under 5, because the explanation is kind of that their brains are absorbing so much more information that they need more rest to process and to do all of those things. So, so sleep, that's why it's added, and it's very important. And it's one that you'll feel better right away if you follow that recommendation. It's not always true with everything else, but with that one, you will.
For sure. Dr. Haidari, anything to add to that? Because sleep is always a very, when you talk to your friends and family, everybody has a different slight opinion on that.
No, I totally agree with Dr. Bowman. I mean, that's what the research shows. And most of the things in cardiology have a U-shaped curve, meaning like if you do too little of it, that's not good. And if you do too much of it, that's also not good. And here in sleep, that's what the data shows as well. I think there's a big stress component in our society related to sleep and in insomnia, and very difficult for so many people. I know we either ourselves or we have family members or definitely patients. So that's a good effort that the American Heart Association has added that to raise that to a level of awareness and, try to work on that. Physical activity helps sleep as well. The more physically active you are, that can actually have better sleep. And as Doctor mentioned, there's something called sleep hygiene. How do you actually get to bed can help you have a more restful sleep.
And another thing is with sleep hygiene is going to bed and getting up at the same time every night. Or every night and every morning. So having a schedule, not where, don't sleeping in on the weekends and staying up really late is like the equivalent of jet lag every weekend. And you know how when you have jet lag, it takes you a while to get over it. Also, room temperature makes a difference. The ideal temperature is 65, which is kind of chilly, but that's the ideal temperature for sleep. For a lot of people, having a heavy meal just before bedtime can be a problem. So, 2 to 4 hours after that, after you eat, is a better time to do it. The exercise is a really big deal. And now, occasionally, people get revved up if they exercise in the evening. You got to know your own pattern. So if that hurts your sleep, then do it at a different time of day. But usually that will help. And again, it's a really good idea not to be looking at these blue screens before you try to go to sleep. So you really should be cutting that out.
Yeah.
Read, meditate, something like that. But, and I find that to be a hard thing. You're just relaxed and just going to get into bed, and you just kind of fun to look through some last stuff, you got to resist. You just have to resist.
Well, I have not heard that about the temperature, but it's interesting when you are away from your regular place that you sleep and I have a friend that she'll keep her temperature on I guess like 75. It's really hot. And I sleep horribly. I mean, I sleep, but you wake up and you're just like, ugh. So I didn't know that was kind of the ideal temperature. So I'm going to have to make sure I tell all my friends and family about that, who tend to be on that hotter side of the equation.
Especially that 73 or a 73 temperature lady.
Oh, I don't know how she does it. The other piece is that both of you mentioned this, and I wonder, it's a little bit of a newer study, and I can't remember where it came out, but they did talk about the consistency of sleep. So, typically we say for adults, maybe it's 7 or 8 hours of sleep, or 8 hours, I guess, is probably the standard. But they said through this study that it was, even if you got like 7, that you kind of had that consistency of going to bed and getting up. It's not these wild swings. Do you have any comments on that? Just when we think about kind of those routines and things that we can start to implement now.
Do you mean different than trying to go to bed and get up because of the jet lag aspect of it?
Yeah, no, just as far as the importance of consistency.
Yeah, in all these things we're talking about, in all of these things, it is really true that small steps pay big dividends, but you have to be consistent on it. You can't, exercise in January and say, okay, I'm fine. You can't decrease your salt for a couple of weeks and then say, okay, I made some small steps here and be fine. You can't sleep well for a week or two. You'll feel better then, but if you go back to your old habits, and it's really easy to fall back into those old habits. And I know Dr. Hodari has experienced this with patients. Somebody is diagnosed with diabetes or hypertension, and oh my gosh, they're really onto it. They're healthier lifestyle, they're taking their medications, they're doing this. And then after a period of time, you just kind of, well, we're human beings, and it goes on the back burner. Other things become more important, and you've lost those things. So if you really want to make changes, you have to commit. Put it on your calendar. Do something, set an alarm on your phone where you tell yourself, I have to stop now, and then do it. I mean, those are things that you really need to do.
Yeah, I had a quick comment on that. And, I totally agree with that. And we know that there's normal hormonal variations during the day. And so, as you mentioned, maybe the consistency would help with that because, your hormones change and, they're ready for sleep, and your blood pressure actually dips at night or should dip at night and surges in the morning. And so, that sleep is important there. And then again, as Dr. Bowman mentioned about the kind of consistency and taking kind of small steps, it's extremely important. I think it'll get you closer to your goals. One other thing I would say, in my opinion, maybe do it with teams too. If you have a friend, or even with your spouse or even with the child, I mean, doing it together helps. It's motivational. Yeah, you can talk about things, what worked for you, what didn't work for you, and don't be afraid to reward yourself. I mean, you don't have to reward yourself with like food, for example. You can reward yourself in a different way, but if you made that goal in small goals, and you can reward yourself with something, that keeps you motivated.
Great. We'll get to, I think there might be a question that's popped up in the around the pulse, but I can't quite see it. So let me see if I can grab it real quick on that front. The question from Beth is, what is a normal pulse / rate for an 83-year-old woman?
I mean, pulse, I can start, I guess, Dr. Bowman. I think maybe different for everyone. I mean, if the person doesn't have any arrhythmia, for example, atrial fibrillation, but in general, somewhere around 80 maybe. Normal pulse is between 60 and 100, probably closer to 100 is maybe a little bit too high, maybe closer to 60 might be a little bit on the lower end. So I shoot for the middle, but it's very variable. I mean, I see people with all different pulses and they're totally fine. I mean, I don't think I necessarily would worry about the number per se, as long as you're healthy.
Yeah, I would agree with that, because sometimes your medications that you're on are either deliberately or as a side effect decreasing your pulse a little bit. And that's fine if you don't have symptoms. Your pulse is too low if you're having dizziness, weakness, if you feel when you stand up, you feel like you're going to pass out. Age makes your pulse a little less able to respond to things, because we have these pressure sensors in our body, and as we get older and things get a little stiffer, everything doesn't respond as well. Now, sometimes athletes, for example, have a normal heart rate in the 40s and 50s because they built up that heart muscle, and so it doesn't have to pump as many times to push all the blood through because it's really doing it. Sometimes, however, older people will have a heart rate in the 30s, and that's because they're not signaling correctly. And then sometimes they need a pacemaker or something like that. So it's variable. I agree with Dr. Hodari. If you're doing well and not having any symptoms, it's most likely fine.
Awesome, thank you. Okay, so Dr. Hodari, you mentioned something that's going to lead us into a really important topic. And so today, hopefully everybody has learned a few tricks on things that we can do to implement a healthy lifestyle. And really, it's about prevention. If we can prevent a heart attack, a stroke, that is much better than actually having to experience that type of heart event. So at the same time, it's Heart Month, as we've all been celebrating today. And I think it's important that everybody is reminded about the warning signs of the heart attack. and stroke, and what to do if you're having or observing someone who might be having that type of heart event. We have a visual that Cherish is going to pull up, and Dr. Haidari, I'm wondering if you can just walk us through the signs of the warning signs of heart attack and stroke for the folks on the phone.
Definitely. Thank you. Yeah, this is a very nice slide. It's really done well to have all these things here. So a heart attack, as you see there, you feel pain in your chest, which is usually in the middle or on the left side of your chest, can be on the right side, but not as common. And when I say pain, I'm thinking of discomfort. It could be pressure, like somebody sitting on your chest, squeezing, tightness. It can actually be burning. It can be significant burning. The pain can move sometimes to your neck or your arms or your back towards your jaw. It can move by itself. You're wondering why is that happening? You might feel short of breath. You can't catch a good breath. You might notice that you are starting to sweat, and you might actually feel like you want to throw up. You might feel nauseous. Sometimes people also get dizzy and lightheaded, like they're going to faint. So these are the kind of classic ones. I want to specifically say that sometimes women have different symptoms. You know, we say atypical symptoms, but these are actually maybe sometimes typical for women. And sometimes these are not, people are not aware of these as well. And sometimes even some people in the emergency room are not as aware of these. So women can feel short of breath, not have chest pain. Women can feel chest pain, but if they might just feel short of breath. Women can actually feel pain in their stomach. So we call it the top of their stomach, or the epigastrium. They can just feel some significant discomfort there. So I think the first thing is to understand that, whoa, I might be having a heart attack. This is not, the food that I just ate last night, or this is not just, a panic attack or something else. You should think that it might be a heart attack first, and you should call 911. That's the very first thing that you need to do. Time is muscle, and there are people that are trained to help you and get you to the hospital and take care of you. So that's the warning signs of a heart attack and what to do.
Can you add anything about a stroke? Because sometimes those can be a little different too.
Yes, so a stroke, so-called brain attack. So a stroke is related to your brain. The heart attack is related to your heart. Both extremely important. I like the mnemonic there, the acronym about FAST, F-A-S-T. And so if you can think fast, you can think about the signs of a stroke. And so the F stands for your face. If you look at the mirror, you'll notice that one side of your face is different, or maybe we use the term drooping than the other side. You smile and that side doesn't really smile. So if there's something wrong with the brain giving a signal to your facial muscles, you can hold your arms out, and then one of your arms will fade down because there's weakness in your arms. So you have arm weakness, and usually it's one side. So one side of your face, one side of your arm, one leg, usually not both. The S is speech. You are trying to say something, but it doesn't come out clearly. So you cannot actually formulate clear words. Or you are talking and it's a little bit like gibberish. So the next person listening to you can't make out what you're saying. You're actually saying words, but they're not going together. And that's a speech problem, and that can be related to your brain. And the T is time. You need to call 911 for that. I would like to add to this that you might also feel dizzy. Some people that feel dizzy or wobbly could be having a type of stroke. And the last one is vision problems, particularly in one eye. Suddenly you lose vision in one eye. That can also be a stroke. And so again, the most important thing is to not, it's to respond to what you're feeling and to call 911. And some people kind of try to not respond to these things and hope that it's going to go away. And so I would recommend calling 911 first, getting help, because again, time is the most essential thing. There's medications that have to be given within a particular time window. So the sooner that you call 911, the sooner you can get those medications, life-saving medications.
For sure. I think a lot of people are somewhat doubtful, and they'll delay that, and then that's not usually a good outcome. Better be safe than sorry. So thank you on that one. So on that notion around warning signs and so forth, Dr. Bowman, I'm wondering if you can just talk a little bit about and share some insights on the other part of the puzzle that we have on this, which is how can we all be prepared if there is either yourself or someone you know is having a suspected heart event?
Yeah, Claire, this is very important. And I want to add one thing to what Dr. Hadari said, or really emphasize that we had a campaign a couple years ago that said, don't die of doubt, right? That you assume it's stress or indigestion, or you don't want to go to the ER, and especially for women, and somebody says, oh, you're just stressed out and you feel embarrassed. Don't die of doubt. Call 911. It is better to get there and not have had a heart attack than to be at home and have it. And have this happen, which is what I'm talking about, which is a cardiac arrest. A cardiac arrest is when your heart can no longer pump blood to your body and it dies and you die. All right. And unfortunately, 90% of heart attacks that occur, or of cardiac arrests, not heart attacks, cardiac arrests that occur outside of the hospital setting, 90% of those people die. And a great part of the reason for that is that nobody does CPR, cardiopulmonary resuscitation. And you'll remember this from when you pumped and then you had to breathe and pump and have to breathe. Now we have found through the research that hands only, I always want to say hands free, which doesn't make sense, hands only CPR works and can save a life. So there are just 2 steps to save a life. Call 911 and put your hand on the, this doesn't work, but on the center of the chest and push hard and fast, much harder and much faster than you think. There's the song Staying Alive and other songs. You want to get 100 to 120 beats a minute, and you really have to press hard and you'll be sweating. And don't worry about breaking anybody's ribs. Don't worry, because a broken rib will heal, a dead body doesn't. So don't worry about that. Women get CPR less from bystanders, and some of the hypotheses are it's because we have breath, right? And people are afraid, and also there's always a concern of, is somebody going to accuse me of something? You're saving a life. If that person has had a cardiac arrest, step in. Call 911 first, because as Dr. Hadari was saying, they can start treatment now in the ambulance. And that's when they can start it. And by the time they get to the hospital, they're ready for it. And hopefully that person can survive. I've been a part of that, where a person had a cardiac arrest on an airplane. And we were able to resuscitate him both with CPR, and then we had a automated external defibrillator, and he woke right up. And we were able to get him to the hospital, and that man lived. And a lot of the arrests occur in the home. And so it's important that everybody learns CPR. I think we have in the chat, we have some references. It only takes about 20 minutes. You can watch a video. There are kits you can get. Teach your family members. Kids can learn this too. Kids can save lives. But it's really, I'll tell you, it's an amazing experience when you help somebody live through something like that. And so we can all be a nation of lifesavers. That's what we are. That's what we're talking about. When that football player, Hamlin, I forget it's for Darnell, maybe Hamlin, I'm not sure. When we watched that on television, when he had a cardiac arrest, he's back. He's back, he's fine, he's playing football, and he's one of our ambassadors for that reason. So think about this, you can do it. We take 20 minutes for everything. Learn how to do hands-only CPR.
Thank you. I applaud you for that passion and compassion around that. It is so important. So we're going to do one really quick speed round here for each of you, and then we're going to, I've got to kind of hand it over to Cherish for some additional pieces. But if there was one thing for those on the phone, whether it's an individual or take back to your family, or if you're caregivers, what would that one thing be for them to take away? And we'll start with Dr. Haidari first and end with Dr. Bowman.
Yes, so one thing that I didn't talk about, or we didn't talk about as much, is smoking. So I'll take a stab at that. Commit yourself to stopping smoking. This is the year. That's your last cigarette. After this is over, no more. And that is a really important thing, because that actually doubles, and in some studies triples and quadruples your risk for cardiovascular problems. So that's the one thing I will say is a takeaway.
Good one. It's very good.
And
we
that
didn't
includes
talk about that,
vaping
yeah.
and e-cigarettes.
Oh,
So my comment is, your body wants to do well for you. It just needs a little bit help. Give it that help.
love that. Awesome. Thank you both. So thank you, Dr. Haidari and Dr. Bowman. Obviously for your time today, but just sharing your expertise and your insights. I am certain somebody is taking a very valuable piece of information back with them today. Really, really great conversation. The American Heart Association is committed to increasing heart health awareness, obviously, for all women and all families of theirs. But today's been a conversation really about how to think about how to take care of our bodies. So I'm going to throw it back to Cherish to close us out.
Well, thank you, Claire. Really appreciated this conversation. It was great to have you with us today. And I want to thank you, first of all, Claire, for leading us in the moderation, and for Regence's partnership in bringing this event to everyone today. And Dr. Bowman and Dr. Haidari, it was really fun to have you with us today and hear your expertise and insights. And I hope that all of you, the audience, enjoyed it as well. We will have a recording of today and all the great links that were shared in the chat. We'll send that in a follow-up to you. Please share it with your friends, with your family. Share what you learned today, because it's on each and every one of us to help share this message and spread the word about heart health. There will be a little survey that'll pop up at the end when you close out of Zoom, and we would appreciate it if you just take a minute or two and give us your feedback. What did you enjoy about today? What else would you like to learn about in future conversations? We'd love to take that into account and build our future programming. So thank you again to our panelists and hosts, and for you as the audience, and we'll see you next time.
Thank you.
Thank you.
Pleasure.